Good morning. Bonjour à tous. My name is Hélène Sabourin, co-chair of HEAL and CEO of the Canadian Association of Occupational Therapists. I would like to first start by acknowledging that the land on which we gather is the traditional unceded territory of the Algonquin Anishinaabe people. I am very grateful to have an opportunity to live, work, and play in this territory.
Good morning. My name is Fred Phelps. Oh, no worries. Good morning. My name is Fred Phelps. I'm the other co-chair of HEAL. And today we'd like to talk about a recent human health and human services survey conducted by HEAL. This survey received 5,000 responses from all provinces and territories, representing a range of geographic areas, from large urban centers to remote communities. The geographic and professional diversity of these responses means that this new data represents the stresses of the full spectrum of Canada's diverse healthcare sector. Organizations for Health Action is a coalition of 40 national health organizations dedicated to improving the lives of Canadians and the quality they receive in healthcare. Our members include professional associations of regulated healthcare providers, along with health charities, organizations that provide a range of healthcare services across Canada. HEAL now represents more than 650,000 providers and consumers of healthcare. HEAL represents the full breadth of the health workforce and all its diverse professions. This survey respondents, they had an average of 20 years of experience in the health field, and members of the health workforce across the country continue to deal with the brunt of the current health care crisis. Most respondents to this survey captured the experience of HEAL members that are not doctors and nurses, yet they are essential to health care across Canada. The survey revealed that 15% of respondents identified as being close to retirement, and almost 60% that their own decision to retire was impacted by the events over the last 2 years. The pandemic, healthcare shortages, the healthcare working conditions were all cited as having impact on the retirement decision. Retiring healthcare workers may lead to a shortage of skilled professionals, which could result in decreased access to healthcare services, longer wait times, and the decline in the quality of health.
More alarming is that close to 30% of respondents indicated that they were considering leaving their profession for reasons other than retirement. This means that over 40% of our healthcare providers are considering leaving the field, and almost 80% of those will leave the field permanently in less than 5 years. The main reason they cited are mental health and well-being concerns, such as depression, anxiety, burnout, despair, and feeling of helplessness. These results align with the results of the Canadian Federation of Nurses Union national survey in 2022, particularly when it comes to workers' retention. According to the CFNU survey, more than half of the nurses surveyed were considering leaving their job within the year. If this happens in numerous areas of our healthcare systems, the current healthcare crisis will seem minor in comparison to the issues that we will soon be facing. With this said, over 80% would consider remaining in the profession if their main concerns were resolved. Respondents cited mental health and well-being concerns, lack of workplace resources, workplace stress as their highest concern in their current work environment. Many of those who are considering leaving do not have a specific plan, but they have responded that they simply need to leave the healthcare field, providing response like anything but healthcare. Unknown, but office work sounds very appealing. I'm going to retail. Anything away from healthcare and the constant short staff and the ever-increasing workloads. It is an indicator of the seriousness of this crisis that these highly skilled and trained professionals are feeling so overwhelmed that they are going to leave their profession without any backup plans. Replacing them as fast as they intend to leave will simply not be possible in the current landscape. Many respondents indicated that they would return to work if the following supports were put in place: more workplace support and resources, such as stress reduction programs and increasing staff, better leadership and management, better compensation and benefit, increase value, respect, collaboration, and engagement in the workplace. They want to feel valued members of the healthcare team. In summary, the result of this survey highlight the urgent need for action to address the concern of our healthcare providers. Failures to do so will result in a significant loss of highly skilled and experienced professionals from the workforce. Nope, that's a hard word for me.
Exacerbated.
The current healthcare crisis. We must act now to provide the necessary support and resources to retain our healthcare workforce and ensure that they continue to provide the high-quality care that Canadians rely on and deserve. Thank you very much. Merci beaucoup.
If you're online and you have any question, please use the raise hand function to notify us of your question. Si vous êtes en ligne et vous avez une question, utilisez la fonction lever la main pour nous avertir de votre question.
Perfect. Merci.